I became a doctor. I was good at science and I was good at things like history, but I kind of got gravitationally pulled into science, and then I wanted to do something that was a little more practical, that you could work with people. So I thought medicine really gave you a chance to do both, where you could really work through the sciences and in the sciences, and also at the same time work with people. It's a privilege to take care of patients. You have to remember that. And patients are people, and people are different. So we have lots of different diseases in oncology, and lots of different stages and lots of different treatments, but you really have to understand the patient. And that's why when I see patients, I take full histories and examine everyone at the beginning, because what may apply to one patient is not going to apply to a different patient. So we basically follow the science and we follow the guidelines, but we individualize per the patients. And I think that's the right approach, because personalities are very different. What you tell one person will be different the way they hear it than when you tell another person. I'm a general medical oncologist, but I focus really now in 4 major areas of cancer, which include GI tumors, lung cancer or thoracic cancers, hematological malignancies, and melanoma. But I also see some cancers. I still have a fairly large breast practice and see a few other varieties of cancer. Plus, I'm a hematologist also, so we're seeing many different hematology questions, anemias and coagulation issues. One of the things that got me into oncology to begin with was that I liked taking care of the whole body and the whole person. So when I was training in internal medicine and people were subspecializing, I really wanted something that would bring the whole body in. So if you're a cardiologist, or if you're a gastroenterologist, you're really doing, focusing on one organ system. As an oncologist, you're really seeing the whole body. And then in oncology, some of the areas that I focus on tend to have more problems with that require systemic expertise. So I like that, and certainly GI cancers and lung cancers are some of the sickest patients, as are melanoma patients. I think the UNC health system, in my view, is the most compassionate and the best system in the area. I think they've set up a great network of clinics and hospitals. And I've also practiced at Rex Hospital for many years, which is an excellent hospital. I've used it myself as a patient, and I would send any relative there. I think the level of care is extremely high. One of the things that I really like about our group and our group practice is that I have some excellent colleagues. And if I'm not around, or if patients are in the hospital and my partners are rounding on them that week or that weekend, I feel they're always getting excellent care. And that's an important thing to me, to be practicing in a system where I feel that everyone's kind of rowing in the same direction. I'm a sci-fi fan. I love Star Trek. I fell in love with it at age 6, 7 in the 60s. And I still follow it. I also have a little nerdy history background. So one of the things is a famous historian named Arthur Schlesinger Jr., and I conned him into having lunch with me about 15 years ago, a couple of years before he died. So a couple of nerdy facts.